Hi, this is Colleen Lehman with the Douglas County Health Department. We've got some changes and news related to COVID that I'd like to share with you right now. Anybody that has come out here to our J600 office has probably experienced the long lines and the shortened testing times that we've had to implement in the last few weeks. Just wanted to let you know that that is probably going to continue until further notice. We are experiencing testing supply shortages and staffing shortages as well, and the two have combined to make it untenable for us to do the full day of testing that we normally do. So until and unless you hear from us otherwise, our temporary testing hours right now are going to be Monday through Thursdays, 8:30 a.m. to 1 p.m., and Fridays, 8:30 to noon. For the rest of this week, we are only doing PCR tests, the lab tests that we send off to Carl Laboratory. We are out of rapid testing supplies right now. We are hopeful that we're going to get some more in soon, but should that not happen, we'll have to continue only offering PCR tests. We will notify you through our social media sites if and when any of that changes. But right now, for this week, PCR tests only. You'll need to bring an insurance card with you, and the results are likely to come back hopefully within 24 to 48 hours, but occasionally it is taking as long as 72 hours when the lab gets very backed up. So thank you for being aware of that. Another thing to do with testing, again, we are seeing long lines. We are asking that you not use the public roadways when you're lining up your vehicle. We are trying to keep that line within the parking lot area out at the mall so as not to negatively impact traffic flow going in and out of the mall. So if you could be mindful of that, we'd very much appreciate it. So thank you for heeding those guidelines. Another big change that has happened in the last few days is IDPH did adopt the CDC recommendations for shortened isolation and quarantine times. So basically what that means is anyone that tests positive for COVID-19, regardless of your vaccination status, rather than having the 10-day isolation period, we are going to a 5-day isolation period. If at the end of those 5 days you are no longer symptomatic, then you can be off isolation, but you are to spend the next 5 days after that masked at all times whenever you're around any other person. If your symptoms are still ongoing after that first 5 days, then you will remain on isolation and you'll just check in with us, and we will let you know at that point. Once you are 24-hour free of fever and some other symptoms, then we can end your isolation. But generally speaking, the isolation period has been cut in half at this time. There are a number of scenarios that have changed a bit with the quarantining also. We do have the full recommendation on our website, so you can look on Facebook, Instagram, and we will be putting that up very shortly also just on our regular website. I'm just going to read quickly what the reduction in quarantine period is if you are a close contact to someone with COVID. If you are eligible to have had the booster shot and have been boosted, or if you've completed your primary series of vaccines within the last 6 months, or in the last 2 months in the case of J&J, then you do not have to quarantine. We are recommending that you wear a mask around others for 10 days, and then on day 5, test if possible. And again, testing is getting kind of problematic because of the lack of tests. Now, that would change if you develop symptoms. Then of course you need to test and make sure that you haven't come down with COVID. Quarantining for people, if it's been over 6 months since you've completed your primary series of Pfizer or Moderna and have not had the booster, or if it's been over 2 months since you had your J&J shot and haven't been boosted, or if you're unvaccinated completely, you will need to quarantine for 5 days. And then after that 5 days, wear a mask around others for an additional 5 days. And again, if possible, test on that day 5. Again, if you develop symptoms, then of course you should test and make sure to see whether or not you have contracted COVID. So those are isolation and quarantining directions for the general public. That recommendation is not applicable to folks in schools, congregate care facilities, jails, things like that. At this time, those recommendations haven't been changed, so you would maintain the recommendations that have been in place for those facilities until you hear otherwise. But again, I refer you back to our social media sites for the more specific guidelines. You can find them on there. We are going to be having a change coming to the PCR tests that we do here at the J600 location out at Tuscola Outlet Mall. It's probably now going to be February before this happens, but we've been talking about the Shield, Illinois PCR test. Rather than having a nasal swab test, the Shield test will be a saliva-based thing. So you will actually spit into a collection tube, and then that is what gets tested as opposed to a nasal swab. So that's a bit less invasive for anyone getting that test taken. There is no insurance required for that, so that's a plus when it comes to this test. We are going to be doing that on an appointment basis, and that way we'll be able to have all of your information already uploaded in a data system, so we don't have to worry about working with all the paperwork. So that'll, we hope, help streamline that process. The one main thing that you as a person coming to get tested and using Shield need to be aware of is you are to have nothing to eat or drink for an hour prior to doing that test so that you can get a good quality saliva specimen for the testing process. So on your end, that will be the main thing for you to keep in mind, and we'll let you know more as soon. We're in the process right now here at the health department of going through all the steps we need to do to get that process set up here within our system and get our staff trained in it as well. So that is going to take probably at best another 3 to 4 weeks. So we'll be giving more information as we receive it, but be aware of that change coming out here. Now, the other thing that I did want to do is just cover some of the numbers that we are seeing here as we welcome 2022 in. We have been inundated with testing demands and positive COVID cases. In fact, from the week of December 27th to January 2nd, there were 218 new cases. 170 of those of which were people that were unvaccinated, 48 people were vaccinated. We are having daily positive case counts as high as 59 people. We've had 59, 56, 48, 50, 40. This is getting to be a usual occurrence, unfortunately. So definitely COVID, and most likely the Omicron variant is out there, as well as the Delta variant. So COVID's still with us here as we start 2022. Our positivity rate here in Douglas County as of December 27th, the 7-day rolling positivity rate was 13.9%, whereas Region 6, of which we're a part, for that same time frame, the positivity rate was 11.5%. So we're just slightly higher than the region's general positivity rate. We did just find out, I think today, I believe it was, that there have been additional 3 deaths of Douglas County residents as reported to IDPH. So that brings our total number of deaths since this pandemic start to 49 deaths now. We had been hovering at 46 for a little while, and that changed today. Those 3 folks that were just reported, there were 2 people in their 40s and 1 person in their 50s. We are starting up our vaccine clinics again this week. So on Thursday, January 6th, we'll be back at Tuscola's Community Building. We have just under 200 people signed up for appointments for the 3 different vaccines, J&J, Moderna, and Pfizer. We can offer first doses, second doses, and boosters. So again, these are appointment-based clinics. So you can go online to our website and get signed up for those, and we strongly encourage you to do so to help protect you from the variants that are out there right now. We will keep you updated and posted as change. We are anticipating more changes coming and recommendations coming in when it comes to vaccinations and when it comes to testing and things. So stay tuned here, and as soon as it's something that is IDPH sanctioned and recommended, we'll immediately be sharing it with you as well. And in the meantime, please just stay safe and healthy, take care of each other, and hope you have a happy 2022.